Hi everyone, welcome back to my YouTube channel. Thank you for stopping by. Thank you for watching this video. If you are new, welcome. I am Regina Umadu, a pharmacist. I hope you all are doing well today and I hope you all are taking good care of your health. In this channel, I'll be teaching how to take better care of your health by discussing diseases and overall health related topic. So if you're interested, please subscribe to my channel and also click the bell icon for weekly updates. And special thank you to all who have subscribed, those who have supported me so far. You guys are really amazing. Thank you, I really appreciate. So today I'll be talking about IBS, Irritable Bowel Syndrome. IBS is also called as mucous colitis, spastic colitis, and nervous colon. This condition should not be confused with inflammatory bowel disease. Have you suddenly developed digestive symptoms that occur after eating food which was not usually there, or on normal occasion you don't have any symptoms after eating this food? Or have you suddenly lost track of your bowel movement? This video is for you. Don't quit yet. Watch this video to the end. Let's dive in properly. Irritable bowel syndrome, which is IBS, is a chronic condition that affects the large intestine, that is the colon. It's chronic because it involves long-term management. It is characterized by continuous discomfort of GIT, which usually occur after eating, and this pain goes off or reduces whenever you go to use the washroom. IBS is not a life-threatening disease, and it's not a condition that will lead to other severe or life-threatening conditions like stomach cancer or Crohn's disease or ulcerative colitis, but it can interfere with your daily life. And for the fact that it can interfere with your day-to-day life, including your work and your daily activities, it is something that should not be ignored. It is something that should be paid attention to. What are the symptoms of this condition? The predominant symptoms that is evidence, ejirimara, or will I say the cardinal symptoms of IBS are diarrhea or constipation, epigastric pain, that is abdominal pain, bloating. Either diarrhea or constipation may be predominant depending on individual, and the severity of these symptoms also varies from person to person. Individual suddenly develop, like right from time they don't have any food intolerance, they don't have any food allergy, then all of a sudden they realize that after eating certain food they will have stomach pain or bloating, they'll feel discomfort in the abdomen. They also lose track of their bowel movement regulation. Their stool lost texture. Normally there is texture that the stool should be, though it do changes depending on the food you eat. It can be hard, it can be soft, but in these people, no matter the kind of food they eat, their stool lost texture completely. It will either be hard, that is constipation, or it will be soft, that is diarrhea. So there is nothing like you usually go to the bathroom in the morning whenever you wake up, like, depending on the individual, because some people, whenever they wake up in the morning, the first thing is to go to the bathroom and poo. Some people in the afternoon or evening, and they have this track, they know, oh, this is the routine their body is following. But in those who are suffering from IBS, there is nothing like that. They lost track of when and when they should go to bowel movement. And also, based on the texture of the stool, when you eat something or when something is not normal with you, you'll be able to identify, oh, this is not how my stool used to be. What could be wrong with me? My stool doesn't used to be like this. But in these people, there is not like normal stool, and it is not matter of what they eat or what they don't eat. And the time at which they go to bowel movement is unpredictable. It is not predicted. At any point in time, before you know, it will flare up. And also for constipation, they can pass days without going to the toilet. So like those who have IBS cannot predict the time at which they can use the washroom. It's just like Obanje. And that makes it hard for the person who is having IBS, because imagine traveling to a long distance and all of a sudden, even it's a place where you can't even find where to stop. It's a very will I say, a very long journey, and there is no nearby place you can stop and say, okay, let me use the toilet. There is no house nearby. And imagine traveling to such place and all of a sudden you have abdominal discomfort, and then you feel the urge to poo. Well, what will you do? Or maybe you attend a meeting or a congregation or a seminar, and then it's the time for everyone to sit in one place. They have announced that they don't want any movement, everybody should be calm, they want stillness, and all of a sudden you have abdominal discomfort and you have to use the toilet. First of all, for you to stand up and violating the rule, you'll be discomfort, you feel the embarrassment. That is number one. Number two is that for you to go and use whatever bathroom or toilet that is there, it's not going to be a private, it's going to be a public toilet, and you expose yourself to infection and discomfort that those who have IBS experience, make life a bit difficult for them, and also sometimes leads to depression or anxiety, which is also secondary symptoms of IBS, though it's rare. So these are the predominant symptoms of IBS. Others are rare. These occur occasionally and also depending on the individual. One is headache, consistent fatigue, that is feeling tired always. Another thing is halitosis, which I also discussed in a video before last. That's halitosis, which is mouth odor or bad breath. Another symptom is dyspareunia, which is painful, like feeling pain during sexual intercourse, irregular menstrual cycle, muscle and joint pain. So now let's talk about the causes. Presently, scientists have not found out any cause. There is no specific cause of IBS, but these are implicated to be the reason why those symptoms occur. Number one is hypersensitivity to pain. It means that individuals become highly sensitive to pain, because normally whenever we eat something, there is always a contraction in the GI tract, and also after food has been digested and absorbed, these two have to move to the colon and also to the rectum when there is contraction. So when individuals become hyper or overly sensitive to pain, this little contraction can lead to those abdominal discomfort. Another risk factor or implicated cause is abnormal nervous system signal. In our body, every activity that the body or every activity that any part of the body does is controlled by the brain, the nervous system. So when there is abnormality in the nerve signal that controls the GIT, it can lead to miscommunication between the brain and the GI tract. Let me explain it this way for you to understand it. The brain will tell the gut, that is the GI tract, to contract. They will contract, and when there is no need for contraction, it will not to contract much. It will control the intensity of the contraction. But when there is this abnormal nervous system, there will be miscommunication. The brain will be telling the GI tract, don't contract, it will be contracting, or contract less, it will be contracting more. So this can also lead to that abdominal pain. So I don't know how else to explain this for you to understand, but this is the better way. I think it will make it easy and for you to understand, because if I try to explain it in details, it involves a whole lot of pathways. Another risk factor is small intestinal bacterial overgrowth. In our gut, there are intestinal flora. These are beneficial bacteria that will help to regulate the environment and also digestion. So when there is overgrowth of it, it will cause these symptoms. Another risk factor is food intolerance, which leads to abnormal sugar and acid absorption. Another risk factor is irregular reproductive hormones. Another risk factor is psychology and emotion, just related to this. But sometimes maybe you're trying to eat, you get excited about what you're cooking or what you're about to eat, and then suddenly someone bring bad news or say something very bad or hurtful to you. Immediately you lost appetite. You will not even have appetite to eat that food. That is emotion. Or sometimes when you are preparing to eat food and someone says something very nasty, though that thing is not there, but because they say it, you begin to imagine it, and then you lost appetite to eat food. There are some people like that. So this is psychology and emotion. So if this thing that I just explained now is applicable, then psychology and emotion can also play a role in IBS. Another risk factor is genetic. That is to say that if someone's father or brother or anybody in the lineage have IBS, there is possibility that they also will have it, though there is no scientific proof to this. Another risk factor is excessive muscle contraction, which is also linked to the nervous system signal abnormality. Another risk factor is mild celiac disease, which I'll be discussing in another video. Some foods that do trigger this IBS are: 1. Dairy products, that is milk and milk products, wheat and wheat products, caffeine, alcohol, chocolate, beans, like any other food that will give someone gas, that naturally will create gas in the gut, will trigger these symptoms. What are the diagnoses? There is no specific diagnosis for IBS. So if you think and suspect that you have IBS, I suggest that first, keep food diary. Like when you're eating food, you write down the food you eat. Or if you have food timetable that you are following, try to be writing down the symptoms you are having when eating this kind of food. So you find out if there are some food that actually trigger your symptoms, so that you can eliminate them and become better. But if you are not sure of it, or maybe there are so many food, even the ones that are not mentioned here, food that trigger your symptoms, then you can go to the hospital for diagnosis. Mainly the doctors will ask you for your food, the food you take, the symptoms. For a condition or symptom to be diagnosed or confirmed as IBS, the symptoms must have lasted for 6 months and 3 times each week. Other tests that the doctor will conduct is to rule out other digestive disturbances, to be sure that it's not celiac disease, it's not Crohn's disease or ulcerative colitis, and it's not food allergy. Once they rule out that you don't have any of these conditions that have similar symptoms as IBS, they will study your food and then find out whether you have IBS or not. Also, they can conduct CT scan to be sure that you don't have any tumor or any cancer in the gut. Complications of IBS, though this complication is rare, like I said, it's not life-threatening disease, but if it's not cared for, because if you don't know, you ignored it, you might be continuously eating this food that give you symptoms. The complications are iron deficiency anemia, difficulty swallowing, unexplained vomiting, weight loss, diarrhea at night, depression, poor quality of life, rectal bleeding, and mood disorder. Before I go forward to discuss about the treatment and the remedy, IBS is also found to occur as a result of so much stress, like those who have very stressful life. The remedy and the treatment. So there is no specific treatment for IBS and there is no cure for IBS. Like I said in the beginning, that is a chronic condition, meaning that it involves a long-term management. So there is no cure for IBS. It can only be managed. Okay, the treatment involves lifestyle changes, because there is no specific medication that when you take, the IBS will go off, just like malaria or other diseases that once you take certain drugs, they will go away and will never come back. It's a long-term disease. You just have to study yourself, change your lifestyle entirely, especially the food you eat. So number one is you have to avoid your trigger. Any kind of food at all that triggers your symptoms, avoid it. Avoid liquor. Avoid sugar-based food. Too much sugar. If you are the type that like sugar so much that if there is no sugar in what you eat, you will not enjoy it, avoid it. And those who like taking so much alcohol, avoid alcohol. Limit carbonated drinks. Eat slowly. What happens is that when you are eating fast, you are also swallowing oxygen, or more amount of oxygen will go into your body, and that will create distension or flatulence in the stomach, triggering the symptoms. Drink a lot of water. Don't be dehydrated. Limit gluten-containing food, such as wheat and wheat products. Increase your fiber intake. That is, eat food that have more fiber. Don't just base on all this fast food. Eat food that have enough fibers. So the other treatment option for IBS is just for managing the symptoms. If your condition is not going well, then every other treatment you will undergo will have to be with a healthcare provider. If your symptoms is constipation predominant, then you have to be treated based on the symptoms that is predominant. If it is diarrhea, you'll be given anti-diarrhea drug. If it's constipation, you'll be given laxative. If it is mixed, then you have to be managed according to the symptoms that leads more. IBS, constipation, laxative will be given, such as lubipristone and linaclotide are laxative used for IBS specifically. And then for diarrhea predominant, these drugs are given: loperamide, cholestyramide, and deluxodolin. And if the condition is based on small intestinal bacterial overgrowth, then antibiotics should be given, most especially rifaximin. And if antibiotics should be given, the antibiotics should be taken for 2 weeks, and after that probiotics should be taken to refill the good bacteria that is in the stomach, because the antibiotics you are taking for small bacterial overgrowth or stomach infection will not selectively kill the bad ones. They will also kill the good ones. And in order to replenish or to fill back the good bacteria, you should take probiotics. Remember, this is just for your knowledge. I'm not saying you should go and practice self-medication. It's not recommended. You should work with healthcare provider, and in order for you not to be lost when he will be working with you, you should know. And that is the reason why I'm sharing this knowledge with you. And also, other treatment option is to manage the pains that come with IBS. In that, antispasmodic is given, such as dicyclamine, and also pregabalin is also given to manage the pain or the discomfort that come with IBS. Another treatment option which is still under process is fecal microbiota transplantation. That is to transfer fecal that is processed or processed fecal from a healthy individual or someone who have a very healthy microflora to those who have IBS. That through this way the symptoms will go away. I hope you enjoyed this video. Please, if you do, give me a thumbs up. Subscribe to my channel, share to your family and friends, and also comment on the comment section below. Thank you for watching. Do take care of yourself and have a good day. Bye bye.